Starting. Dr. Solle.
Good afternoon, everyone. I see everyone is just logging in, joining in. So we will wait till everyone gets here and we will start. So we'll just give everyone a few minutes.
Dr. Malay, have you registered to join?
Am I in the wrong window again?
Yes.
Okay, I'll get off. I'll get off.
Okay.
Sorry.
Bye.
No worries. All right, so it is 2 minutes after the hour. I think we can go ahead and get started. Thank you guys all for being here today for our monthly seminar series. I'm very excited to be presenting today. I'll be talking about our education program and our education curriculum. I'm lucky enough to have our Senior Research Associate, Emily Brown, introduce me this afternoon. So go ahead, Em.
Hi, everyone. Yes, so I'm Emily. I'm a senior research associate for the Firefighter Cancer Initiative, and my main research projects are the Survivorship Program and the Empower First Responders Program. It is my pleasure to introduce our seminar speaker this afternoon. Dr. Natasha Schaefer Solle is a research associate professor in the Department of Medicine and Public Health Sciences at the University of Miami Miller School of Medicine and Sylvester Comprehensive Cancer Center. She serves as the co-deputy director of the Firefighter Cancer Initiative, a multifaceted project funded by the state of Florida to study firefighters' exposure to carcinogens, examine their cancer risk, and develop methods of education about prevention and early detection, leading the Firefighter Cancer Prevention, Education, and Survivorship Program. Dr. Schaefer Solle's research interests focus on occupational cancer risks and improving cancer screening in underserved communities. She has extensive experience in qualitative research methodology and community-based participatory research. Most of her work has involved engaging minority populations in Florida to help circumvent barriers to care and increase cancer screening practices. The focus of her research is well aligned with her leadership role at Sylvester Comprehensive Cancer Center as the Assistant Director of the Behavioral and Community-Based Shared Resource, where she is responsible for overseeing research services used to facilitate biobehavioral and population research, reflective of catchment area need for cancer center investigators.
Thank you, Emily. So very long 9 year, but thank you. I really appreciate you introducing me. So really excited to share with you all some of the work that we've been doing in the space of education. I'm going to go ahead and start sharing my slides. Education is, to me, one of the most important things of how we can not only share with our firefighters about the risk, how to mitigate those risks. But what we've learned over the years is reteaching. So yes, we may be able to go to a class once or learn it when you're in the fire academy, but we're learning that, in order for practice to change and culture to shift, we need to make sure that we're educating on a regular basis. And so I'm going to walk you through some of the resources that we've created, not only for our firefighters, but also for people in practice and clinical practice, as well as academia. So the goals of today is to, go over just an overview of FCI. I know many people on the call are partners and collaborators, but for any new faces who have not know the depth and the reach of FCI, give you a little bit of background, and then go into our curriculum and some of the resources we have, and then talk about one of our initiatives, the Torches Fellowship. Before we start, I'd just like to acknowledge our funding. So we are funded by the state of Florida appropriation, as well as the National Cancer Institute through the center grant of the P30. And we've also received funding from FEMA. So to give a background a little bit on the Firefighter Cancer Initiative and when it started. So we formally established in 2015 through a legislative appropriation that was supported by Jeanette Nunez. So it's crazy to think that we are in 2024. The beginning of this year, or of next year, 2025, will mark our 10 years of working in this space of firefighter cancer prevention and control, and to see how much it's grown from when we started, of sitting around the table with firefighters from Palm Beach County and Miami-Dade Fire Rescue who came to Dr. Kobitz, our PI, and shared their concern and the issue that they saw among their departments and through their retirees as well, and where they were seeing an excess burden of cancer. And so through this entire process, we have been partners with our firefighters. You can see some of our firefighters include the FACE team, which is Firefighters Attacking the Cancer Epidemic, the Florida Firefighter Safety and Health Collaborative, and the Firefighter Cancer Support Network. Among those, in addition to those, we have several other partners that really have sat at the table at every step of the research process for us. So not only when we're coming up with an idea for a research study, but then also really evaluating what we're creating. And that's super important when we're doing education or any of the resources that we have developed, because we want to make sure that it's something that firefighters will use and that they will look at and say like, oh yeah, like I will, it will resonate with them. We don't want to create anything that really won't make a difference. And so we've been really fortunate to partner not only with our local organizations and local departments and unions, but also national and international organizations such as the IFF, the National Volunteer Fire Council, as well as the International Association of Arson Investigators. And so we've really strived in, not only working with our structural firefighters, but also all subgroups. So working with our volunteers, as well as the fire investigators, inspectors, trainers, USAR, and military and wildland firefighters. And so through our work, not only through research, but in our education and our outreach, we've engaged over 22,000 firefighters through FCI. And so that is nationally as well as internationally. We have about 24 active research projects that are happening. And then, as you can see, we also have our clinical piece where we offer cancer screening. So we do have 2 mobile vehicles that have been turned into mobile clinics that we partner and contract with local fire departments, where we go to the actual stations, provide annual physicals, and then refer them for cancer screenings and other referrals as needed. And so we've been able to provide over 1,000 cancer screenings through our clinic. And then also through our research and our clinic of screening, assessing screening behavior. So through questionnaires, we're able to assess what behaviors our firefighters are doing. So are they having colonoscopies, mammograms, skin checks, And we've been able to assess over 12,000 firefighters on their screening behaviors. And so these things are really important. So, I'll go through a little bit of the 6 pillars that make up FCI. And so all of our work really builds on each other. So as I mentioned, our active research projects, which as many of you know, we have several active cohorts. And these are where we ask those questions about behaviors and about cancer screenings, whether it be risk behaviors or protective behaviors. And that then drives our next step of what do we do from an education standpoint. So, learning about an increased incidence of melanoma in firefighters, and specifically in Florida, seeing not only an increased incidence, but also an earlier age of diagnosis compared to the general population. And so then we've looked at how can we educate on skin cancer and educate on melanoma, and making sure that our firefighters are understanding their risk so then we can see change. So just to give you an overview, and this is kind of what we look at when we're creating any of our curriculum or any of our resources and how we can work with the firefighters, but we really want to know our population. And so we know the U.S. Workforce, the firefighter workforce, it's estimated of just over 1 million firefighters, both career and volunteer, with about 37% career firefighters, which we see an increase from the previous year, and about 68% are volunteers, which we've seen a decrease. We know that 7% overall nationally are women firefighters, and that 51% of firefighters right now are between ages 30 and 49, and there's over 29,000 fire departments in the US. So again, knowing the demographics, knowing our population, it's also important for us to then look at, between the ages 30 and 49, what cancer screenings are they due for? And then how can we create information to share that? So we know that that largest group based on age, that we're sharing what they're eligible for as far as cancer screenings go. The other thing I mentioned at the start, that we really don't just focus on our structural firefighters. We're really looking at our structural, our volunteers, our airport, our military, wildland, fire inspectors and investigators, and fire trainers. And so what we've been able to do with our curriculum is add new modules to them that are specific to these type of subgroups. So not only to know what their risks are and how they're different than your typical structural firefighter, but also what changes to make and how they can reduce those risks. So to give a little bit of background, I know many of you, if you've been on any of these presentations, you've probably seen this before. But again, just if we have any newcomers, so we know why are we studying cancer in the fire service. Here we have from the World Health Organization, the International Agency for Research on Cancer, monograph 132. And so that's looking at the classification of the occupation of firefighting and how it's classified as a cancer risk. And so this group meets every 10 years. And what happens is it's a group of scientists from all over the world that come together. And what they do is they bring together all of the literature and the science that's been done in the last 10 years to see if that occupation, if their exposure as a firefighter in this case, if it's changed over the years due to new literature that's been released. And so this was released in 2023. They actually met in 2022 when they pulled everything together. And prior to that, the last time they met was in 2010. In 2010, when they met, firefighters were considered a group 2B carcinogen, so possibly carcinogenic to humans. However, when they met most recently in 2023, which a lot of the work that they were using and a lot of the literature they were able to pull from work that had been done from our investigators here at the Firefighter Cancer Initiative. And so with that, the occupational exposure as firefighter has actually been changed to a group 1 and is now considered carcinogenic to humans. And so you can see, depending on the different cancer type, there was sufficient evidence for being group 1 carcinogenic. So you could see here it's mesothelioma and bladder cancer. And they also saw an increase in other cancers. However, they considered it limited evidence, including colon, prostate, testicular, melanoma, and non-Hodgkin's lymphoma. The other thing they looked at was the mechanistic evidence in exposed firefighters. So not only are they looking at the types of cancers and cancer surveillance as far as the incidence of types of cancer, but also what is happening inside the body of firefighters that may be increasing their risk for cancer. And so with that, they were able to see genotoxicity, epigenetic alterations, oxidative stress, as well as chronic inflammation. The other thing looking at is exposure. So knowing what firefighters are exposed to on a regular basis, and of those products, which ones are considered carcinogenic. And so what they noted was diesel exhaust, building materials, asbestos, chemicals, shift work, as well as ultraviolet radiation. They also took into account the various types of fires that firefighters are exposed to. So again, we've taken all of this information from the IARC monograph and added this to our curriculum, and then really focused on, especially in the exposure aspect, and knowing that those are aspects that firefighters can change. That's what we've really focused on, how we can address practice change within the curriculum to see long-term change in our firefighters, which we'll go over in a little more detail. And here you can see is just a little bit of a larger scheme to see what this meta-analysis showed for incidence in different types of cancers. So as we mentioned, mesothelioma was the highest, and then followed by testicular, non-Hodgkin's lymphoma, bladder cancer, colon cancer, thyroid, prostate, skin melanoma, and kidney cancer. So now here are the 6 programs or the pillars of the Firefighter Cancer Initiative. So I know, each seminar you hear from someone from each of these groups. So today we're really going to focus on our cancer education, and how we're able to pool and work together with all of the other groups based on the work they're collecting, and then how we can move that forward and make change and implementation change for our firefighters. So for example, working with our epi and cancer registry team, seeing the numbers as far as cancer incidents in the fire service in the state of Florida, seeing which ones are high. Again, as an example, we see thyroid cancer, we see melanoma, and then how we can educate our firefighters on that, specifically on practices that they can change. Very easy as far as, as simple as wearing sunscreen while they're working, and, to making sure they're getting screened by a dermatologist if they haven't in the past. And then learning about, from our environmental exposure sampling team, from what they're seeing, what compounds and chemicals that they're seeing firefighters are routinely exposed to, how they're being exposed, for us to then create specific modules on how they can make those changes to decrease their risk. Okay, so moving right along into our education curriculum. So we actually started this pretty early on in the Firefighter Cancer Initiative's life. So we started around the second year creating this curriculum, and it really came about because when we started in 2015, we learned through focus groups that cancer was not talked about really at all. And when you became a firefighter and you went to the fire academy, there was never talk about cancer. There was never that there was never a module or a chapter that you learned, like, by being a firefighter, you're exposed to certain things, and this may increase your risk for cancers. We learned that, safety was a big thing, learning obviously how to put out a fire and go in and out, and a lot of tactical procedures were taught. And so one of our main things when we started and when we pushed this out in 2017, working with the state fire marshal's office, was creating a policy change that when a individual goes through the fire academy, they now go through a curriculum on cancer prevention. And so working hand in hand with the State Fire College and the State Fire Marshal's Office, that has been happening. And so in addition to that our new firefighters or firefighters to be in the academy, we also realized around 2019, 2020 that, the reteaching model. So not only for those who are just becoming firefighters, but it's really important that we're teaching everyone, all the incumbent firefighters, because maybe they never learned about it, early on in their career. And so that's what we've been doing, been following up and teaching all the different incumbent firefighters where they've been on the force for, 5 years, 10, 20, or about to retire. And so really giving them a hands-on experience with the different prevention tools that we've come up with, as well as providing them with all of the resources that we've created. And so, our main thing is we look at the hierarchy of control, and we really apply this to total worker health for firefighters. And so for those of you who are not familiar with the hierarchy of control, it's really of how we can work to decrease someone's risk and what you can do. So by going down this cone, you can see there's certain things that are really out of our control that are not going to happen. So we're going to do the best that we can do. And we do this in each aspect of the risk for our firefighters. And when we're teaching the curriculum, we're constantly using this model as an example of what they can do, whether it be related to their gear or deconning. And so, eliminating work conditions. A lot of time that's not an option. Obviously, we're not going to be able to eliminate the diesel exhaust or the exposures that you are around during a fire. But then maybe there's other things that could happen. So we've seen with other departments, we have seen redesign. So we've seen that people have been able to redesign the way the station is laid out, redesign trucks that they've used a clean cab model. And then obviously is the next layer, which is education for safety and health. And this is really what our curriculum has really focused on, but sharing ways of how they can maybe redesign certain things depending on their department, and possibly how they can substitute or make changes in their policies or programs. And so we've really used this hierarchy of control as our foundation and base for all of our teachings in our curriculum. So here you can see this is the curriculum, and we're actually working really diligently right now of changing the look and feel. This is still very much active, and so you could see the QR code, you could see the link. You guys are all welcome. It is free to anyone who wants to go on there. It has all of the slides, all of our resources, as well as like case studies and interactive activities to do. Why we're changing the format. So the content is staying the same in addition to some of the things that we're adding. However, we've gotten feedback from firefighters as far as being able to complete the program, but getting some type of proof of completion. So we're actually moving it. It will be on the same Bright Outcome platform. It will just mimic our cancer survivorship, so that when someone goes through this, it doesn't have to be done just by us in person. So I'll go through that here. Our module overview, you can see our learning objectives, but there's 3 different ways that the curriculum can be delivered. So it can be a self-learning tool where, a firefighter can have the link and they can go through this themselves. Or we've worked with different departments on putting it onto their target solutions, and so they can go through the modules themselves. And then we've also gone through in person, which a lot of times is what we've been doing, is going and partnering with different departments, showing up, especially with new recruits, and giving the lecture. And then we're able to do some hands-on. However, for those departments who've really been interested in doing the self-learning and target solution modules or format, there was really no way of knowing if it's been completed. And so that's why we're moving to, you can go through each module and then get your certificate of completion as well as add CEUs for it. Right now, we're only able to add the CEUs if it's done in person. But with the online, we have everything as far as the evaluations, our videos, any of our handouts and PDFs that we've created, they're all part of the curriculum. And so you can see our main objectives that we go through are, defining the scope of cancer and the cancer burden in the fire service. So again, everything that we've created has been from feedback of our firefighters. So having focus groups when we started to hear exactly what are important things, what do people want to know, and how can we deliver them in a way that is, very easy to understand, and people are interested in learning about it. So one was really understanding the literature, what is out there, what studies have been done. A lot of times they don't want to go and do, a Google search because they don't know what resources are reputable. And they want to know what is the most up-to-date things. And so we've done that. We've added that. And so the first module we go through is really about all of the literature that has been conducted about cancer in the fire service. Then we go specifically into identifying the firefighters' cancer risk. So talking about what risk they may see, whether it be from their gear, and either not washing it or not, wearing PPE correctly. Also going through, the transition from a fire exposure into the fire apparatus and back to the station. What are you doing from those steps? And then going into how you can reduce those risks. And so our module 3 is our largest module of how you can make change, and really looking not only at how you can make change when you're at the station, but then also how you can make change, from an organizational level when you're at the station, but also from a policy standpoint. And then the second part of module 3 is at an individual level. So again, we talk a lot about, how being a firefighter and the occupation of firefighting increases your risk because of exposure. However, we know, cancer risk is very multifaceted. So looking at you as an individual and what you can change as far as risk modifying behavior. So we have a whole module on diet, exercise, sleep, stress, vitamins, overall exposure, what you're using as far as your pans and other practices. And then our last two are really looking at, again, identifying those organizational level changes that can help you reduce your risk. So not only the practices that you're doing as an individual at the station, but then what can you do to work with leadership in your department to make change overall, whether that's making sure that your department is having annual physicals or cancer screenings, and then also other policies, whether it's, changing drivers wearing a half mask so they're not exposed to the off wind of the fire that's coming off. Other policies, we share different policies that have been successful in other places throughout the country. So then firefighters can take that back and use that as resources. And that goes right into our last module, which is pretty straightforward and just gives a list of different resources and different organizations that can help any of the firefighters who are part of the curriculum. So here's some of the strategies. I didn't want to go through the actual curriculum, but I wanted to really give you at least something that, I can pull for you and show you what we recommend. So from an individual level, as I mentioned, we talk about the annual physicals, including a comprehensive history and physical exam, looking at all the body systems. So not just, I know we're focused on cancer screening, but looking at everything, cardiac, pulmonary, hearing, vision, hormone, mental health screenings, then focusing on our cancer screenings. Part of our education, we also include our our health screening passport. That's really, on our clinical side, but we share that with our education as far as what screenings are recommended and how we've based our screenings off of the American Cancer Society, the U.S. Preventative Services Task Force, and NFPA 1582. Sharing information on healthy nutrition and diet. So, not just saying, eat healthy, but really breaking it down. We have several slides that we talk about specific diets because that is something that has come up every time that we have met with firefighters. Should I be doing the paleo? Should I be doing intermittent fasting? So we break down and show you the pros and cons of each one of the different diets that have been popular among the fire service. Talking about regular physical activity, avoiding risk behaviors, and then good sleep hygiene. Obviously, we know good sleep is hard to come by when you're on shift, but giving recommendations and practices of how you can better your sleep hygiene with different strategies for napping, whether you're on shift and then when you're off shift. And then, as I mentioned, we really go through the organizational strategies. So again, talking about decontamination practices, not only giving slides on it, providing the SOPs and the SOGs of what needs to happen and are, printables that can be used within your department. Also includes 3 of our videos that are specific to decon practices. One that shows you what happens when you don't decon. The second one that really takes you step by step, every step of the decon process. And then the third one is an FAQ of questions that come about after going back into a fire with wet gear. Talking about reducing carcinogen transmission and making these policies really regular practice within your department, showering within the hour, having no gear or PPE in the living quarters, transferring your gear in airtight containers when you're in a personal vehicle, and then talking about washing your safety gear regularly. And so that's your personal uniform. So looking at having a second set of personal uniform, using your station washing machine for all of your station clothing. So not bringing that back home. Implementing a hood swap. And then if your department has the resources for a department extractor for the fire gear. And then, consistent use and practice of SCBA and PPE. And the big thing is established policies and a health and safety officer committee. So this one's really interesting because we've been doing a survey called the FAST-C, a protocol that we've been doing for several years now that we always bring and survey at the Florida Fire Chiefs meeting, the one that was actually just rescheduled now for December because of the hurricane. And so it's really interesting because we've always asked about change within a department and how change can happen. And one of our findings from this FAST-C survey is it had nothing to do with the size of the department or the location, whether it was rural or in an urban or metropolitan area. It was really change happened, was most seen when there was established policies and when there was an established health and safety group that was able to advocate for the health and safety of the members as well as cancer prevention strategies and activities. So these are just, 2 general slides pulled together, but you can see we break down each of these things in the curriculum, but just to give you an idea of, kind of what it looks like. So I move into this next piece because it's going to take us into some of the data we've collected. So from our curriculum, not only are we, pushing it out and sharing it, but when we go and we're doing it in person, we're also doing an evaluation. We're doing a pre and post test to see if knowledge has been gained, and then we follow up 6 months later to see if practice has changed. So as part of that survey, We also have been asking questions about the green buckets and the decontamination kits that come with it. So as many of you know, in 2018, we worked with the state fire marshal's office to deploy over 4,500 green buckets. In those buckets, it had everything you needed. You can see there all the contents with the hoses, the scrub brush, the bags, the Dawn soap, and the hose head, as well as the operating guidelines and the field operating guidelines, which are all included in that bucket. And so, a few years after everything had been deployed, it really came up, we needed to evaluate. We wanted to see if people were using the buckets and, what we were getting from it. So we originally had only sent it to the fire chiefs. And again, through feedback from our firefighters, they said, if you really want to know the practices of what's going on in a department or in a station, you really need to ask everyone, not just leadership, but really people who are, boots on the ground. And so with that, you can see this is again just a little graph of what we've done in person with our Florida counties and with our 226 that have enrolled in person. Here just again some pictures with the green buckets and our team that has done some outreach in all the different departments that we've gone to in the last couple of years. And so in addition, as I mentioned, with the education, not only are they getting the curriculum, they're also having access to all of these different resources. So these are PDFs and they can download these, they can have them printed, which we have. And most recently, we've been able to take these same education curriculum because of feedback that we've received from other countries, that we've translated these into Spanish. So this has not been deployed yet, but we are working on these. So this is something that is really hot off the press that we've been working on. And that will, we're working with other fire departments in other countries who want to share what we've created with their departments as well. So, as part of, another aspect of our education, as I mentioned, is when we go in person, you can see some firefighters there cutting up some fruit and making a salad, is nutrition. Nutrition is a really big piece and a really top concern of firefighters. And so what we've done, or what we do when we go out in person, not only do we do the curriculum, but then we do a hands-on piece where we can show firefighters some really easy and healthy meals that they can make while they're at the station, for a large group. But then that also triggered another research question. So we were educating on nutrition, what are proper ways, proper meals for snacks and while they're at the station, while they're working, what they can make for a large group when they're at the station. And then firefighters were asking us, well, how healthy are firefighters? Do we know? And so it was actually something that we had not been collecting through any of our cohorts. And so we created the nutritional assessment of firefighters. And so this is really a very simple study, really for us to just get an understanding of firefighters' diet and cancer risk factors. And so we do this with the collection of a survey where we look at diet through the dietary screening questionnaire, their physical activities questionnaire through the God and Leisure Time exercise score, their sleep, and then their alcohol intake as well through the audit C. And so in addition to the questionnaire, we've been able to purchase what you can see there is a veggie meter. And this looks at a carotenoid score. And so the carotenoid score is, you could see this firefighter is just putting his finger down. And so it's able to read the oils that come off your finger and is able to tell us your fruit and vegetable intake, in the last 3 weeks. And so you can see here an average score is 200 to 300, with 400 to 800 being above average. And so some just preliminary data with our, we've had 207 firefighters representing 19 different states who have participated in this, with a mean age of 42 years old. We do see that their Godin score was at a mean of 57. So we saw with, overall, our firefighters are more active than the general population. So we saw 76% of active, 9% insufficiently active or sedentary, 10% were moderately active, and 5 chose not to answer. And then when we look at our carotenoid score, which tells us about their fruit and vegetable intake, as I mentioned, you could see here our, average score is 200 to 300. Our firefighters averaged at 273, so very much in the middle. But what we have been looking at is the difference between our careers and our volunteers. So we do see our careers having a healthier diet than our volunteers. So our sample size for our volunteer is smaller. So our plan is we actually will be in Panama City for a volunteer summit that we're hosting for volunteer firefighters, where we're expecting to, have, close to 100 or over 100 volunteer firefighters, where we will then collect, hopefully more of these scores, and we can see the numbers and see what changes we have. Oh, here we go. So I'm sorry, there's a double. That's why I got a little thrown off there. But here's the buckets that I was explaining. And then here I can give you the feedback of our evaluation. And so what we did was, from concept to practice, the integration of decontamination buckets among our Florida firefighters. And so the goal of this was to really understand the utilization and the acceptability of the decon buckets. And the initiative that happened. And so it was part of a 33 item questionnaire, asking specifically about if they've used the bucket that was provided by and the Firefighter Cancer Initiative. And so just some simple demographics. You can see 137 firefighters responded, equally distributed. We had 19% from 18 to 25. 25% were from 26 to 32, and 33 to 40, and rounding out at 18%, 41 to 48, and 12% at 49 to 60%. 86% were male firefighters, and 83% were white, and 59% identified as non-Hispanic. And so when you see what the response was, 29% had said they have never used it, and 71% that they had used it. And so we see here some of the differences with the sociodemographic characteristics stratified by their use. We do see an increase by age. So those that were older were more likely to use the decon buckets, as well as our male firefighters. And then we saw a difference in our Hispanic group and our non-Hispanic group as far as who used the buckets as well. You can see more likely our Hispanic group, those who are Hispanic were more likely to use it than not. And so moving forward, I know there's been a lot that we've done so far with our curriculum, and we did it for several years, and still continue to do it. One of the feedbacks we got 2 years ago was, how can we make what we've created in the curriculum more accessible to our firefighters? And so, where they don't have to look online everywhere, or, if they're unable to join, one of these seminars, how can they see what's been created and have it at their fingertips? And so the idea was to come up with an FCI cancer prevention toolkit. And so, as I mentioned, as easily accessible as possible for our firefighters. And, our toolkit includes monthly notification with cancer screening reminders, also includes ability to enroll in any of our open research projects that they're eligible for, share our up-to-date events, and then also share cancer screening recommendations in our nurse navigation services for anyone who is looking for screenings, but also anyone who has had a cancer diagnosis. So I will leave this here if anyone wants to screenshot and see the QR code. These are free, these applications. It could be on Android or Apple. It's very straightforward. Or if the QR code's not working, all you have to do is go into your app store and search Firefighter Cancer Initiative. And here's just a screenshot of what our dashboard looks like. So as I mentioned, this has every resource. It gives you an overview of FCI, also includes all of our investigators. So, you may have been on a seminar last month or the month before and said, I heard someone talk about PFAS or tobacco policy, and I can't remember their name, but I really wanted to ask them a question. You can go on the app. Everyone's email is there. All of our active research projects are listed, and it shows you what the aims of the study are, what are the eligibility criteria. It may be something that you personally are interested in. You can reach out. The contact information is there about enrolling, or it's something you say, I would love if FCI came to my department and did the curriculum or offered one of the cancer screening projects. That's all there. All of the curriculum materials, some of the ones that I showed you, they're all on here as PDFs that you can download. All of the videos that we've ever created are on here, as well as all of the recorded videos from our seminar series, our International Firefighter Cancer Symposium. So really everything is at your fingertips between the YouTube channel that's there, as well as the Vimeo links of all of the educational videos that we've created. The other really important thing is our clinical aspect. So we have information there on, what to do if you're diagnosed with cancer, how we can assist with navigation, with phone numbers and who you have to call. And also cancer screening recommendations. So again, the PDF of our health screening passport is there. Really important because you can see it gives you, the front page gives you the breakdown of what I shared with you on the IARC monograph of why firefighters are at increased risk. On the second page, it breaks it down by body system of what screening should be done and at what age. And so there's one for females and there's one for males. But it's really important when firefighters are going to see their doctors and they can share that with them, because maybe your clinician doesn't know about the increased incidence of certain types of cancers, and you can share that with them. We also have resources available with our collaborators and our stakeholders that you'll have access to, and then any of our upcoming events, whether it be our summit, our symposium, our seminar series, or any event that one of our investigators are attending, whether it be a firefighter conference or a academic conference. So here you can see, we've been sharing this nationally. We're almost about 700 downloads. And so, we just keep sharing and we keep adding to it. So, even if you downloaded a while ago and you haven't checked in, you can check in and see all the different changes. We change it on a regular basis to make sure things are, staying up to date. The next thing is our physical toolkit. So this is something that we put together this year. You can see there's a picture of it. And basically we've taken everything that we've created in the online toolkit and printed it out for a physical toolkit. Because we've realized that everyone is different. Some people like having things, in the palm of their hand and they can look at it, but some people like to actually go through things and have the information. So this is something that is brand new. We have not launched it yet. Our plan is to work with health and safety officers, health and safety committees, but really anyone who's interested in education within the fire department, that we can work with on sharing this information and then how they can disseminate it to their departments. So, we know that we're only one group of individuals at FCI, that we can't be at every department. And so our goal is to train other firefighters who want to then deploy this and share information and really teach their departments on cancer prevention. And so that's something that will be pushed out this year in year 10. The next thing I want to mention that has been a big piece of our education is our Torches Fellowship program. So our Torches Fellowship, we have selected, it was a process where people applied, but it is for firefighters to partner with researchers here at FCI, where we train them on foundational research knowledge, and they pull together and create a research protocol and start collecting data. So it's a 12-month duration. They receive formal didactic component and then practical research experience. So we're so fortunate. We have firefighter Laura Foster from Green Valley Volunteer Fire Department in Huntington, West Virginia, and Brian O'Neill, an assistant fire chief from San Antonio Fire Department, and they have been doing phenomenal. And so I just wanted to share, actually, Dr. Firefighter Foster has just started data collection. She's doing volunteer firefighters' perception of health and safety through photo voice. So that is a really innovative method of qualitative research, where instead of just having an interview, she's having them take pictures of what they perceive as either a health and safety risk, or something that's promoting health and safety within their department. So she's just started data collection. We're really excited to move forward with it. And then Chief Brian O'Neill is doing also a qualitative study where he's going to be doing interviews and focus groups with firefighter cancer survivors, focusing on the reintegration into the workforce. So really understanding what challenges and barriers firefighters who are survivors who return to work, what goes into that. And so really excited to see the data that comes out of that. And they will be presenting this work at this year's International Firefighter Cancer Symposium in February. The last piece I want to share with you of what we've been doing with our curriculum, not only are we educating our firefighters, working with our firefighters on becoming researchers, but also working with our healthcare providers, sharing with them and training them on the cancer risk of our firefighters. So we've been doing several presentations with primary care clinicians, as well as nurse practitioners and PAs, key things that they should be asking as clinicians, what they should be looking for, and also just educating them on the different risks that firefighters have. Also sharing with them a guide of, as you can see there, questions and things that they should be asking. And as always, providing them with the cancer screenings and the cancer screening passport that we've created. So with that, I know we're almost at time. I just want to share again and remind you our 2025 International Firefighter Cancer Symposium, which again will be a hybrid in person at the Shalala Center in Coral Gables. For those that are unable to attend in person, it will be online as well. We look forward to having another great round of speakers from all over the world to be there. And in addition to that, we have our Dolphins Cancer Challenge. We have our Firefighters vs. Cancer team again. You can join. The registration link is there. And if you have any questions, you can reach out to us. We can give you the code for free registration, and then covering your costs for the fundraising fee. So always love having our firefighters be a part of our team. And please reach out if you have any questions. Lastly, as part of our 10-year program, we are collecting patches from fire departments that we've worked with. As you can see, we've received several in the mail or in person. So if you have not sent in a patch and you would like to be part of our commemorative patch project that will be displayed at the symposium this year, please feel free to mail us your patch, and our address is right there. And so with that, I will close up and see if there are any questions in the chat. Okay, so the first one asked if we could share where we purchased the carotenoid scanner. Yes, I can definitely share that. The company's called Veggie Meter. But if you send me an email, I can actually give you the contact information, um, for the vendor. And then I see would love to help disseminate. So thank you, Dr. Hamlin, who's a great partner of ours in San Antonio. Happy to share. I can send you printed copies if that's easier for the toolkit or QR code. But it's such a great resource for firefighters to go through. And what's great, what I've seen with leadership is they've been able to, everyone is on their phone. So instead of having to worry about sending an email or printing something out, you take a quick screenshot and send a text to your crew and just say like, hey, check this out. This was interesting. So it's really a great resource. The next one is, I see that you have many firefighters enrolled in your studies, but there may be others who are not. I'm curious if you have noticed any effects on these educational activities on the non-enrolled firefighters in the same department or even not the same. So it's hard for us to see that. We have not done that yet. I mean, so a lot of times when we go to the fire stations and we do the curriculum, we go for 3 days. So, we catch mostly everyone that's there. Obviously, if people are off, and it's not mandatory, so not everyone has to do it. But we haven't evaluated those who have not completed the curriculum to see if there's any type of change. We are looking at right now, and it wasn't ready for today, but we have seen just preliminary, we are seeing pretty significant increase as far as knowledge gain from pre and post of the intervention, and then also in our 6 month follow-up, seeing an increase in positive behavior change, whether it be, keeping the bay doors open, or moving their gear into a closed compartment as they switch from different vehicles. So we are evaluating that, but I think it's a really good point to look at those who have not completed it. Okay, great. So we've got some interest from Oregon Fire. So we can reach out to you, and if you have my email, I can put the slide back up. You guys can feel free to email me at any point, and we would love to get you on board and share everything that we've created. Again, these are free resources that we've created for the dissemination for our firefighters. What percentage of firefighters who get cancer are able to claim for the presumptive legislation? So that one is tough. I don't know, because each state is different. And each state has different presumptive laws. In the state of Florida, I believe we covered 21 cancers. Some other states cover all cancers or just a handful. So I don't have those numbers, unfortunately. All right. Well, thank you all so much. We really appreciate everyone being here. Next month, there will be a change in the schedule. We will send that out very soon, probably by the end of this week or early next week. As you can see, we're always scheduled for the third Tuesday of the month. So assuming everyone will be getting ready for Thanksgiving, we're going to push that up a little bit. And our team members from the environmental sampling program, Dr. Donner and Dr. Deo. And Dr. Takichi will be representing our ESP team. So we're looking forward to learning about what they've been doing in our environmental sampling program, and looking forward to seeing you all in November. So thank you all for being here. Always wonderful sharing the work, and thank you all for what you do.